You are now about to start video 2 of Trauma-Informed Care training. We would like to remind you that at any time during this training, if you feel like you need to take a break or step away, please do so. You can then come back and continue where you left off. After learning about trauma, its effects, and its prevalence, you might be wondering, how does this apply to me? There are 3 things that staff members can experience when working with people with trauma: burnout, compassion fatigue, and secondary or vicarious trauma. Burnout is defined as feeling hopeless and having difficulty doing your job effectively because you think your efforts make no difference. Things that contribute to burnout include organization structure, discipline, lack of support, and overwhelming caseloads. Next, we have compassion fatigue. Compassion fatigue is the overall experience of emotional and physical fatigue that social service professionals experience due to the chronic use of empathy when treating clients who have experienced suffering trauma. Secondary or vicarious trauma occurs when you have a relationship with the primary person who has experienced trauma. So you yourself have not experienced trauma, but you are either a coworker in a relationship with a person with trauma or friends with somebody who has experienced trauma. What are the differences? So burnout and compassion fatigue are work-related hopelessness and feelings of inadequacy. They're more about being exhausted, whereas vicarious trauma is about being afraid. A great example to show the differences: burnout and compassion fatigue, you come to work, you're dreading going in and you're kind of just sick of doing the same thing over and over because you feel like it's not helping anyone and you're getting burnt out. That's what you're feeling. If you're experiencing vicarious trauma, that means it changes your entire worldview. So if you're working with children and you've seen abuse over and over, it might change the way that you are protective of your children or things along those lines. Experiencing burnout and compassion fatigue are actually normal in this field. So between 40 and 80% of helping professionals develop vicarious trauma or compassion fatigue in their career. With social workers, 70% exhibited at least one symptom of secondary trauma, but only 42% said they suffered from secondary trauma. So there's a disconnect between experiencing burnout and compassion fatigue and recognizing it in ourselves. Child welfare workers, 50% had traumatic stress symptoms in the severe range, and 34% met the PTSD diagnostic criteria due to secondary traumatic stress. Hospice nurses, which are relative to the PASAR staff at MHMR, 79% had moderate to high rates of compassion fatigue, and 83% did not have a debriefing support after a patient's death. So we see that you're not alone if you are suffering from burnout and compassion fatigue. Many others in this field are suffering as well. To find out if you are suffering from burnout or compassion fatigue, please pause the video in a moment to take the Professional Quality of Life Scale. It is a 30-item self-report that you will score on your own. Please feel free to pause the video now. Now we will continue with this video. To decrease the risk of secondary trauma and promote self-care among counselors, there are 6 key things to focus on. The 6 key things that can decrease the risk of secondary trauma and promote self-care among counselors are peer support, so getting support from your coworkers and other people in the field; supervision and consultation, working with your supervisor to manage high caseloads; training, which would increase your confidence and skills in dealing with hard cases; maintaining balance, which will help keep your work life and your private life separate; personal therapy, which will help you deal with your own traumas and stresses in your life so that you can focus on your clients more fully; and lastly, setting clear limits and boundaries with clients. The single greatest thing to combat burnout and compassion fatigue is self-care. Taking care of yourself outside of work will help you be more replenished for when you come back into work. We have a self-reflective process that will help you develop a plan to take care of yourself. It covers physical, mental, emotional, and spiritual categories. We would like you to pause the video and take 5 to 10 minutes to answer at least 2 questions from each category. This will help you create your own comprehensive self-care plan. Please pause the video now. Once you're finished making your self-care plan, we would like to make you aware of staff resources available through MHMR. Some staff resources available are the Employee Assistance Program, the Family Medical Leave Act, vacation time, employee choice days, and in your packet you have a going home checklist, the SelfCare wheel, and on your phone you can download the Provider Resilience app. The Provider Resilience app is something you can download for free on Apple and Android devices. It shows you the last time you have taken a vacation day. You can take a quiz about your burnout and compassion fatigue, and it will tell you where you are on your resilience scale. It also gives you suggestions for things you can do at your desk to improve your day, resilience builders, and things you can avoid, resilience killers. This app is available to all staff. This concludes part 2 of Trauma-Informed Care training. We are now going to move on to our next section, implementing trauma-informed care.